Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Collecting duct carcinoma. Collecting duct carcinoma is also called as Bellini type of carcinoma. This collecting duct or Bellini type of carcinoma is the rarest type of renal cell carcinoma. Number one. Number two, it is composed of malignant cells. Here it contains some malignant cells, and these malignant cells are present within the prominent fibrous trauma in the medulla. See, in the medulla, number one, there is prominent fibrous stroma is present. Okay, this is the prominent fibrous stroma. In the prominent fibrous stroma, at a site, you will see the presence of the tumor cells are seen in the prominent fibrous stroma. So, these are the malignant cells which are seen in the prominent fibrous stroma. Okay, so these are typically in the medullary location. The origin, as the name says, it is collecting duct carcinoma. So it also originates from the collecting duct in the medulla, and this has a very aggressive course because it goes out very faster. So it grows very fast, so it has very aggressive course, and it also has a poor prognosis because of this aggressive course. Then, if you were asked what is the most commonly associated malignancy with sickle cell anemia, then it is medullary carcinoma is most commonly associated with sickle cell trait.
thank you and thank you for watching.